So we are focusing on pregnant refugee women, and we're calling the app Hababy, or Habibi Baby. So the challenge is, so women like 18-year-old Miriam, a Syrian refugee from Aleppo, who was 7 months pregnant when she came to Lebanon, didn't have access to the vital information that she needed and feared a miscarriage. And this is definitely an experience that a lot of women have, and they don't have access to the care that they need. There are a lot of pregnancy complications to begin with, and it gets even more complicated when you don't have access to doctors and the health care that you need. Okay, so the solution is, so we've created a web app that will have accurate, culturally sensitive, and actionable information for family planning, prenatal, during your pregnancy and postnatal care. So the whole idea is to have something really simple where if a woman is in an immediate care situation and needs help fast, she can click through our app and figure out what advice she needs, what information to tell her doctor specifically, if she is able to get to a doctor, or if there's anything she can do on her own. And we are hoping to partner with NGOs, primary healthcare providers on the ground, other apps like Universal Doctor, which translate medical terminology in a bunch of different languages, and with the refugee women and the locals themselves to try to get more people to figure out that this app exists and to ultimately get other people to input their information into the app. Now we have a demo. So we basically created a platform where you can first choose either English or Arabic, and it is Arabic ready. There are a few very, very rough translations for the symptoms, but we primarily only have English speakers on the team. So basically once you... Okay, there it is. Essentially, once you pick a language, you're walked through a picture of a pregnancy at different stages. So you can click on a picture of a woman who is not pregnant, and it directs you to maybe if you don't want to necessarily have a child at this moment, but it's all phrased very much in a family positive way. The other pictures are basically separated into first, second, and third trimester, and then you can pick symptoms based on those timelines. And there's also during birth advice and postnatal care for your child and yourself, so immunizations, breastfeeding, things like that.
Sorry guys, small technical issues. If you just scroll up. It's always right when you do a presentation that you realise that your computer doesn't like doing presentations. Wait, go down a bit, Sarah. There you go.
What are doing that?
Right.
We're not even doing it.
No.
It doesn't work for voluntary. No, because I think that voluntary which doesn't work.
3 days. 3 days.
Sequentially. You can say like you can do like
There we go. We're getting somewhere. Slowly, surely. Okay.
Okay, sorry about that. So our general idea that we kept on reiterating through the process was keep it simple, stupid, because we want very clear information very easily. So you arrive on this page, and this is live, by the way, so if you do want to look at it on your mobile, it's vaguely mobile ready. We didn't really spend much time on the design. Thank you very much for the crowd, to everyone who helped. You can have a play. So the idea is that you come and you click on either language. It is, I'm going to say Arabic language ready. but we haven't got any translations. But as soon as we put the translations in, they will appear because language is set by a session cookie. So you click here, you see some images. We're trying to, make it really simple, and then you basically get a list of your symptoms, and you can see the relevant information for what you do. It's crowdsourced. We try to. Sorry, I had all of these links up. Can I spell symptoms? Oh, okay, cool. Yay! Okay, so basically you can very easily create, so the idea is that we give this to nurses working on the ground and they know exactly experienced healthcare professionals. We are working with a midwife today who is giving us all the relevant symptoms, but the idea is that you can just very, very easily add to this database and
I think that's pretty much it.
it's pretty much it. You can just see, we didn't get around to styling that bit. And it also offers family planning advice and pretty much.
Thank you.
Cool.
Actually,
Oh,
I do
sorry,
have a
yeah,
question.
go.
So, you had an admin section.
Yeah.
Who are the admins going to be?
NGOs, healthcare professionals, anyone with the knowledge basically. Currently it's perfectly open, anyone can add in.
Should I be using this? Anyone can add in information they want. It's potentially dangerous, but there's only so much time in the day.
The advice given during pregnancy is different between different countries that the pregnancy might be in. Is the app specific for different countries?
It is. Sorry, I forgot to mention that.
So we're teaming with this amazing group, HealthMate in the back, to make our information country specific. So if a woman needs to find a doctor immediately and she's not in a camp, she's transitioning and traveling, where does she go? She can click on, where do I go? And it'll direct them to their app.
It's a really important point, and it's really great that you actually attack that, because in the UK, you may be able to get to see a doctor for free if you're pregnant, but if you're a traveling refugee and you're in another country, they might actually be like, well, you have to pay for, so it's good that the advice is country specific.
The whole app is, all the symptoms and all the advice is tailored so that you can tailor it to countries and languages, and you can input for both languages. And you can both select, there are options, we didn't show it, it's not quite finished. There are options for you to select your country and select your language, and it tailors all the advice accordingly.